Kia ora, everyone. Let me just share my screen here. Okay, so the topic today is just to revisit behavioural support for smoking cessation. We often focus a lot on interventions, whether it be pharmacotherapy or financial incentives. So I just want to revisit some of the stuff that should be bread and butter, I suppose, for all of us working in this space, which is, well, talking and listening to people, what it comes down to at the end of the day. But there are some specific behaviour change techniques, which I know that you all know about, but I just want to, I guess, summarise these. And I've pinched a few slides today from Jennifer Percival, who is one of the trainers for the UK National Centre for Smoking Cessation and Training, and has done a lot of work in this field, especially around motivational interviewing, and I'm going to touch on that as well. So in terms of helping people to stop smoking, I think it's really important that it's not our job to make people stop. I often get this message from clinicians that say, I'm sending someone to you so you can make them stop smoking. And we just can't do that, of course. If people don't want to stop, it's very difficult to change their behaviour. So really it's all about working with someone to help them change their behaviour over time. And some people might be ready to stop pretty much straight away when you see them. Other people might be a little bit unsure, a little bit nervous, not confident in their ability to stop. And you may need to invest a little bit more time in helping understand some of those barriers, but also trying to help them see or build on their confidence for quitting smoking long term. So if you're looking at just the role of behavioural support, it's pretty simple, really. One is reducing motivation to smoke. And there are a whole lot of motivations to smoke, and you usually explore these people with people in the first session. It might be being out with friends. It might be stress. These are all drivers of smoking. And part of the role of behavioural therapy is to reduce that. We want to bolster commitment to quitting completely. And this is why we talk about that monster on the shoulder. We talk about doing your very best from the quit date to not have a single puff. It sort of puts that stake in the ground, as you know. And this is one of the top behaviour change techniques. Number 3, enhancing the ability to cope with cravings and other withdrawal symptoms. So we know that medicines help do this, but we're also helping people to say, look, withdrawal symptoms, craving, they're going to be there. They're worse in the first 2 to 4 weeks, but they will get better over time. And there are some ways that you can help to cope with these. So, you know, lots of people still use the 4 Ds of delay and drink water, etc., etc. And whilst that's fine, I think you could be a little bit more sophisticated in trying to understand what some of the key drivers of craving are, and then focusing on ways to reduce those.
What are some examples of ways that you would use to reduce those?
Well, I think a very simple example would be if someone smokes in social settings. They go out for their standard drinks on Friday or Saturday night. Then one way to cope with all of that is just not to put yourself in that situation for a few weeks until you're past the worst. If you have to go out, then it might be changing your routine, perhaps in what you drink. Or making sure you go to somewhere where you have to stay inside and you can't smoke. So it's trying to look at the environment around you, but also some of those key drivers for prompting urges to smoke and perhaps avoiding those in the first instance. Okay. And of course, number 4 is, and this is a behaviour change technique, is explaining what stop smoking medicines are on offer, helping people to use them. I've just done a service audit, and for a good proportion of Māori and Pacific women, they're not using any stop smoking aids. And I think sometimes we're just too quick to say, oh, okay, that's your choice, without really giving them good information about why we use these and how they can help. So I think do put some time into this.
Sorry, Hayden, do you have any insight into why Maori women are not choosing not to use medicines?
Well, I don't have any insight for Māori women particularly, but in general, the reasons why people don't use medicines are they worry about them. They've heard all sorts of things. We've seen this with Champix, for example. Oh, don't use that. You know, that makes your mood go haywire, or you get weird dreams, or you get nightmares. And people worry about this. And if you don't mention it and reassure people, then people won't, they just don't want to engage. Or they'll say, oh, my auntie told me that vaping causes popcorn lung, therefore I won't use it. And instead, what we should be doing is saying, well, look, can I tell you a little bit about what I know about these things? And spending time and reassuring people, because we know these things can help, as opposed to, oh, well, that's your choice, and moving on. Because if people can't make an informed choice if they don't have the right information. Okay, just looking at behavioural interventions, and I'm going to show you a few from lowest effectiveness. These are all effective interventions, but from lowest to highest. So text messaging, online programs, digital apps, for example, can help people stop smoking, but overall they have low long-term quit rates. Better than nothing though, of course, better than nothing, but these increase quit rates a little bit. A little bit more is telephone support. So you're actually talking to someone at the end of the phone seems to be just a little bit better, although I might argue that these two are pretty close in effectiveness. Then this is about, this would be like getting a prescription from your doctor who says, this is the medicine, this is how to use it, set a quit date and go from there. So a little bit of support with medicine. Better still is individual support, face-to-face with stop smoking medicines or pharmacotherapy. But best of all is group-based treatment with pharmacotherapy. So this is still at the top of the list. The best way to deliver support, it seems, is in groups combined with stop smoking medicine.
And what's your take on why groups are so much more effective than all the others?
Well, I think there are a whole lot of extra support mechanisms within group-based treatment. So you've got people quitting together, you've got people sharing the experience, you've got support from others within the group. So you're bolstering people up, not only with the support that you can provide, but also the support from people within the groups. And those of you that run groups know that this can work quite well. Now, in terms of treatment, it's not actually that complex, but you typically break it down into a number of different sessions. So you've got your pre-quit appointments, and it should have an S on there really, because there might be more than one, especially if you're offering a cut down then quit approach. Sometimes if it's with nicotine replacement therapy, the quit day and the pre-quit appointment might be all in the same appointment, right? You've got people coming along, they're saying, I really want to do this. I've already had my last cigarettes, I'm ready to go. And so sometimes you have to merge those appointments all together if you've got people motivated to quit right there and then. You don't need to say, oh, no, I need to have a separate quit day appointment with you. You've got to be flexible in these cases. And the same as if you have people that are not quite motivated to quit yet, you might need to have a few appointments before you get to the quit day. I still like a quit day appointment because you're seeing them on the day. You really have a chance to increase their motivation and support and talk to them about what to expect in the coming weeks. But if you can't do that face-to-face, a quick telephone call is often all it takes just to show that you're caring, it's their quit day and you're there to support them.
Hayden, I know when you work with people to support them to stop smoking, you advise them to smoke as normal up to their quit day. Can you explain why you do that?
Yeah, I don't typically, in people that are doing abrupt quitting, so I'm not talking about a cut down then quit approach, but I'll say, right, I just want you to keep on smoking as normal right up until your quit date. I do that because I don't want people, or sometimes when people cut down, they find their cigarettes more and more enjoyable and so more difficult to give up. So it's really simple. Look, just smoke your heart out. Once you get to the quit date, that's where you're committing to doing your very best not to have a single puff after that.
Okay.
Follow-up appointments. Again, we've talked about this before. It doesn't have to stop at 4 weeks post-quit date. I know this is a measurement point, but it's not how you should be running your service. Okay, so it could be over 2 to 3 months. It could be longer, depending on your clients. Remember, most medicines we say use for at least 8 weeks or 8 to 12 weeks. That's the course of treatment for Zyban, for Champix, for most NRT. And our behavioural support should be followed up on that over that time as well. It doesn't mean you have to see people weekly for 2 to 3 weeks. You could do weekly for the first 4 weeks, and you could go fortnightly or monthly. Work a program that suits your clients. And there probably will be a final visit at some point, where people say, thanks very much, I think I'm okay now. And you say, that's great, but the door's always open, so you can always come back and see me. Now, motivational interviewing, because people often ask me about this, and should we be using it? I use bits of motivational interviewing all the time. I find them helpful, but my whole program is not based around motivational interviewing.
Hayden, can you just explain what motivational interviewing is?
Well, I was just going to get to that, Grant, because that's the second bullet point. What is motivational interviewing? So it's essentially a counselling style, and it helps people get through or work through their uncertainties, their risk-taking behaviours, lifestyle habits, whatever you like, but it does it in a way that doesn't tell people off. It doesn't tell people what to do. It avoids this confrontation. And you know this when you're, if you're ever trying to tell people what to do, they're almost certainly going to say, no, I don't want to do that. So it helps people step through making decisions themselves. And you use a lot of open-ended questions, or you might say, what would stop you from doing that? Or what's going to get in the way? So it's just a nice way of having the conversation. And I like it because you're really not giving any direct advice. You're using people's own skills and judgment to help them make the decisions. And remember, it's their behavior they're trying to change, not yours. In terms of these principles that motivational interviewing uses, resist the righting reflex. This is the urge to change a person's action by telling them what to do. Health professionals are often the worst at this. We've got so many things to say. I think that you should often goes the way. You should do this. Or have you thought about doing this? So if you can resist giving the advice and get people to come up with their own actions.
Well, how would you phrase that?
Well, it's a lot of the time is about asking open-ended questions. What could you do? Or what do you think could get in the way? So if you're saying, if people have already told you that going out to drink on a Friday night is associated with, that's a time they always smoke. Instead of saying, well, you should not go out on Friday nights, you'd say something like, what do you think that you could do about that? Or have you already thought about what you might do to avoid that situation? So it's less about giving direct advice and trying to get people to get to that decision themselves. It's also understanding that it's the person's own reasons that brings about the change, not yours. It's about listening to them and listening to what people say. So the solutions lie within them. And it's also about empowering the person to understand that they have the ability to change their own behavior. So it's a little bit of it's motivational at the end of the day, but a big part of it for me is not fighting and trying to get them to come up with their own solutions.
So just using that technique to someone who's smoking, highly dependent, and they're very resistant to using stop smoking medicines. What would be a motivational interviewing strategy around that situation?
Well, you could ask them about, what is stopping them using smoking cessation medicines, or how do they think that they'll cope without using stop smoking medicines? So it's a way around exploring some of their barriers to change. Often, though, you're not going to get to that point straight off because you've still got some advice to give. This is not about not giving any advice whatsoever. Okay, so you don't leave it all open. So you still need to go in. And I always say, is it okay if I tell you about stop smoking medicines and how they work and how they can increase your chances of quitting for good? Okay, so you've still got a bit of direct advice to provide, but the motivational interviewing is about exploring some of that resistance. Okay, and a big consideration here is attitudes and beliefs. If you believe that Champix is harmful because it gives you nightmares, then you ain't going to use it. And so trying to adjust some of those beliefs or asking if it's okay if you can tell people what you know about it can help people make up their own mind without you saying you need to use Champix. Okay, so skills, you know this, open-ended questions, really important. Reflective listening and summarizing. So, this is about, I've heard you say this, did I get it right? And you can summarize it back to them. And exploring the resistance to change. So it's not about, if someone says, oh, I just can't do that. I just can't not go out on a Friday night. You might use some questioning to say, well, can you tell me a little bit more about that? Or what would happen if you didn't go out on one Friday night a week? And people might get around to saying, well, actually, perhaps a couple of Friday nights not going out wouldn't be the worst thing in the world. Now, I just want to touch on evidence-based behavior change techniques for smoking cessation because there are a few of these. And I'm going to go through these relatively quickly because I'm just aware of the time. But I think that you use these already. Now, giving information on stop smoking medicines. You do this, you do it with all medicines, and you make sure you address some of the common side effects. You're giving information about additional support. This might be Quitline. You explain your program, what else is there available to help provide some support. You're going to provide information on tobacco withdrawal symptoms. You're not prophesizing that they get every single tobacco withdrawal symptom, but you talk about the common ones and you talk about the time course and what they can expect. You explain the purpose of CO monitoring. Remember, it's used as a motivational tool and less as a lie detector. You're going to facilitate and advise on social support. So having others in your social circle to help you get through this sometimes difficult time is going to be really important. I remember social support is not referring people on to some social support service, but about finding friends, whānau, that can support them through the time. At all visits, you're going to use your CO monitor as a motivational tool. You're going to emphasize the importance of not a single puff. And again, not as you're not allowed to have a single puff, but trying to get them to see the rationale for not a single puff. So remember, one puff is all it takes. It wakes up that crazy little green monster and you're back smoking again. Getting commitment from the client to that. Again, I would say in individual sessions, now that I've explained the importance of trying to get through without a single puff, can I hear you say back to me, I'm going to do everything I can this week not to have a single puff, or something like that. If it's in a group, you can get people to stand up and promise. Advise on ways of minimizing demands. So this is about demands, sort of the drivers for smoking, if you like. So trying to set them up in the week. You don't want to be starting your smoking cessation journey on a week that you're highly stressed. If stress is a trigger for smoking, then that's going to be potentially disastrous. Advise on ways to change routines. Think about, and this is why we sometimes get people to write smoking diaries, okay, because you want to see when they normally smoke. Mixing it up a little bit can help get over those initial periods of discomfort. You talk about relapse prevention. You talk about coping with these difficult moments. They don't last forever. If you can get through it, they'll get less and less over time, and you will get better at coping with these. You continue to check on the medication. If they're not having enough, you adjust the dose. You know all of this, but it's a really important behavior change technique. Give information about normative experience. This is about being normal. Yes, you are going to feel a little bit down perhaps when you quit smoking, or really having cravings that can be quite intense are normal, but they do get better over time. This is a little bit of acceptance and commitment therapy stuff that you could use here, where you've got to expect these cravings. They're going to come because you're stopping smoking, but they will pass by. And if you focus on something else that you enjoy, or committing to some of your values or things that you like doing, I don't know, looking after your kids or something like that, can help really distract you and focus on what's important. For us, giving praise all the time if the client hasn't smoked, really important. And always giving an encouragement and bolstering their confidence, especially if they've had a little bit of a slip. Slips happen. It's important that they keep coming back and seeing you and get back on track. And of course, underlying all of this is you just being a nice, friendly person. You're not the smoking police, as I always say. And you're continuing to develop and build that good rapport with your clients. And that's kind of it in a nutshell. And if you can integrate all of these within your counselling, then you'll be doing a good job. Remember, you can't remember all of those. Here's the top 5. Having good rapport, using a CO monitor as a motivational tool, explaining how to use stop smoking medicines and why, explaining the rationale for not having a puff after the quit date, and getting some commitment to doing that. Okay, so these are the ones that are really important to do with every client.
Hayden, can I just touch on, I've heard you talk about the link between rituals and routines of smoking and dopamine release.
Yeah.
Can you just touch on that briefly?
Yeah, so when you smoke, other behaviours that happen at the same time as smoking, let's just say your morning cup of coffee, they become secondary reinforcers. Okay, the primary reinforcement is the nicotine from your smokes. But paired over time, other behaviors become paired with the smoking. So your brain's already expecting a reward. So if you have your morning cup of coffee and you know that, or you usually have a cigarette straight after that or even with it, then even just preparing your morning cup of coffee can trigger an urge to smoke. And that's because over time, it's become paired with the smoking. And you've already got a little trickle of dopamine release starting just from having that morning cup of coffee.
So you would change that? You would.
Yeah, so change. That's why we talk about changing these routines. You're trying to uncouple the behavior, which might be drinking a cup of coffee, with the reward, which is typically the nicotine from your cigarette. So if you switch from drinking coffee to an orange juice, or just not having that coffee straight away and waiting until later in the morning, then that can help in that quitting approach. I won't go into this too much, but good news here. Specialists are better at generalists. Okay, so all this training you're getting and everything else does get you into a specialist level, and specialists are generally better at helping people to quit smoking. So these data are from the UK Stop Smoking Services, and specialist practitioners had significantly higher 4-week quit rates than generalists. Okay, so keep on doing what you're doing. You're more likely to get people to quit smoking. So you do play a really important role. In terms of talking about quitting, and I'm just mentioning this because sometimes you have people that are just not ready to do it, or they're really unsure. And so this is where you do need to see their situation from their point of view. There's no point in arguing with people. If they're saying, oh, I've got this happening and I've got this happening, or I'm really stressed and I don't think I can quit smoking straight away, you might need to take some other steps, some realistic first steps to move people along and build on those strengths. So if you're using a cut down then quit approach, for an example, then saying, okay, well, let's halve your cigarette consumption. You measure that, you see them, you give them praise if they've managed to do that, and you show them that they are making progress to get to the ultimate goal of quitting smoking completely.
And you've done a webinar, which is on our website, about down to quit using stop smoking.
Exactly. Yeah. So have a look at that. It's I think still abrupt quitting is really good for most people. And if you've got people turning up that are pretty ready to get going, you don't need to go through a cut down then quit approach. But occasionally you'll get people, especially those with mental illness or other drug and alcohol dependencies, then you might need to just rethink your approach. And it's not just what you say, it's how you say it as well. It's just a little picture that I found in some old slides. Try our cough syrup, you'll never get any better. Obviously, that's saying, try our cough syrup, it's the best stuff there. But, just watch what you say and how you say it. That's important. Withdrawal symptoms, you all know about this. This is really important. Remember, the key messages here, they're common. They typically last or are most severe for the first 2 to 4 weeks. The medicine and support that you give all help reduce them. And those tips for avoiding cravings, avoid triggers, just, stay strong, not a single puff, the urges will pass. Exercise can be helpful. Being prepared can be helpful as well. And we've talked about this, but changing routines and habits, don't forget these, go through them, see if you can find or help people find something different to do. Smoking contacts and support, sometimes it might be best to avoid them. Again, in a motivational interviewing approach, you wouldn't jump in and say, right, I suggest you avoid all your smoking friends. You might say, well, that sounds like it could be really difficult. Have you thought about how you might deal with that and try and get people to come up with their own solutions? And again, high-risk situations, beware of these. Sometimes it's not always possible to avoid going to these, and so you need sort of some action plan in place or escape routes that people can practice and use if they get to a point where they have an urge to smoke. And it can be really simple. It could be, if I have an urge to smoke, I will use the lozenge, or I will use my vape instead of smoking, whatever that case, whatever you decide, and just keep it as simple as that. So not too many plans and actions that you can't remember, just one and very clear. And again, the triggers that people often talk about, stress, it's just a habit, boredom, especially for some people. So trying to get some things in place to deal with boredom, weight gain, social, I miss the taste, the enjoyment. They do eventually go, but it's important to advise on these. More important to use your motivational interviewing techniques to get people to find their own solutions. So in summary, remember how we speak to people is just as important as what we say. Listen carefully, show some understanding of people's lived reality, and understand also that it's your client or patient that's responsible for the choices they make, not you. Your job is to help them find their own solutions. And people typically change when they're ready to do so, not when they're told to do so. So for some people, that might be a little bit of a long and winding road to get to where we're going, and our services should be set up to help those sort of people, not just turf them out and hope for the best. So different solutions for different people is what's really needed. And sorry I went over a couple of minutes there, but I think we've got some time for questions if we've got them.
Okay, so what I'll do, Fano, is I'll unmute everyone. If there's a party going on in your office off camera, you might want to ask people to shush a little bit. So we're all going live now. If you've got any questions. Hayden's ready to take those. So, oh, something's not working here. Oh, here we go. Sorry.
Oh,
There we are. So everyone's live now. If you have any questions for Hayden, go right ahead.
I do.
All right.
Hayden, you mentioned weight gain could be a trigger for relapse.
Yep.
So what is your advice about helping people with that?
Well, the weight gain thing, Amy, is quite difficult because most people gain some weight when they stop smoking. So I'd address that up front, and don't leave it to the end. And especially if someone's already overweight, you've got to definitely get in there and talk about it. Don't ignore it. Sometimes people feel a bit embarrassed, especially if someone's overweight, talking about weight gain. And I would often say, weight gain is really common when people stop smoking. Is that something you're worried about? And let them tell you what they want to do. Certainly using nicotine replacement therapy for long enough, and Zyban is another one that can reduce the weight gain associated with stopping smoking for at least as long as you use those medicines. And then it's really just general advice that we give about healthy eating. Increasing their levels of physical activity can help as well.
Thank you.
Does anyone else have any more questions? Yep, we can hear you. No?
Not anymore, Carol.
Hi, Hayden. Just a couple of things I have used over the years when you're looking at people that are really ambivalent is, and it has worked quite well for me, is when they're talking about cutting down and stuff, I've actually suggested that they have a practice smoke-free day.
Right.
They can't fail at practice. That's what we tell our kids all the time. And they actually get it. So to have a practice with a patch and some lozenges has worked really well. And sometimes the next day they go, oh, actually it wasn't as bad as what I thought it was. So a practice smoke-free day has always sort of worked quite well for me for the people that are really ambivalent and just sort of thinking about doing something.
That's a great idea, Carol, and I've indeed done that a few times as well. And I can recall a few people that came back and said, I had a practice quit day, but then I just carried on not smoking because it wasn't that bad.
Yeah. That's a good. And another thing also, I feel like when we're talking about the craving signs is, the way that they're feeling is often to say, well, these are recovery signs as well. So to think of them as not so much as bad, but actually this is a good thing. I feel good about this, even though I know they're hard at the time. My body's recovering. I'm starting to feel a bit better.
Yeah, that's great. And it's a nice way of rephrasing tobacco withdrawal symptoms.
Thanks. It's been interesting too how you said today about people with setting themselves up to quit and all the medicines in that. I have had quite a few people just recently that are just going cold turkey. So around the plan about just stopping without it after trying everything else, maybe I'll just try cold turkey. I tried it 15 years ago. I did it for a year, Some of them it's quite fascinating. I've been surprised that they're just going, I might just try cold turkey. So it definitely is looking at a good plan around how
if they're still seeing you, they're not going cold turkey. They're just choosing not to use stop smoking medicines. A lot of people perceive cold turkey just meaning no medicine. Cold turkey means no support whatsoever. No advice, no quit line, no text, no nothing. So you will see that. And this is not about forcing people to use stop smoking medicines. It's about saying, hey, look, let me tell you about them, and you can make an informed decision once you know all the facts.
Yeah, for sure. Yeah, thanks. It's been very interesting this morning. Cheers.
Final question from anyone? No? Okay. Great. All right. Thank you very much, Hayden. I think that was your best one yet. I learned a lot, so That was really good. Anything you'd like to add before you leave, Hayden?
No, that's been enjoyable. Something different. It's always to break away from all of the other more technical stuff.
Great. Okay, and remember everyone that this has been recorded, so if people you know would appreciate watching this, it'll be on our website this afternoon or tomorrow at the latest, so they'll be able to find it at nts.org website and check it out. Okay, great seeing you. See you next month. Have a great week.